My name is Dr. Ashley Fisher, and I'm a clinical neuropsychologist with the Early Supported Discharge team in Calgary, Alberta. In this video, I'll discuss what anxiety and frustration are, why they arise, and share some practical strategies to help manage these emotions. Changes in mood and emotion are common after any medical event. We know that after stroke, up to 20 to 50% of all people experience problems with depression, anxiety, and apathy, in addition to concerns with fatigue and cognition. These numbers mean that many people with stroke will experience feeling sad, anxious, or frustrated at some point in their recovery. Mood changes can be troublesome, and if ignored, they can interfere with rehabilitation and can impact quality of life. As you watch this video, remember that these strategies are first steps for dealing with emotions. If you are concerned about depression, anxiety, or another mood change in yourself or someone you love, it's important to reach out to your physician or another medical professional. There are effective treatment options, including antidepressant medication and therapy for dealing with mood changes and depression. Please see the 2019 Canadian Stroke Best Practice Recommendations if you want more information. One of the questions I'm often asked is, how do I know if I'm feeling frustration or anxiety? Frustration is a feeling of being annoyed or irritated by a circumstance. It's a normal reaction, and it happens in response to changes in abilities or difficulty accomplishing a task. After a stroke, things like loss of independence, fatigue, overstimulation, or cognitive problems are all common sources of frustration. On this slide are a number of common ways that people can experience frustration. These include things like overreacting to minor annoyances, feeling a general lack of patience, low tolerance for change, anger, irritability, or mood swings and intense emotions. Feelings of frustration are more likely to occur when you are feeling fatigued, if you're in a new environment or an overstimulating setting, and during high levels of stress. Anxiety, on the other hand, is worrying about what might happen or what could happen. When we feel anxious, we shift our attention to what we believe is dangerous. Most of the time, this is actually healthy and it keeps us safe. However, anxiety can get to the point where it isn't healthy. Anxiety levels that are too high or too low, particularly over long time periods, actually can lead to an increased risk for compromised health, including heart disease and stroke. This slide shows some of the common ways that people can experience anxiety. It's important to remember that many of the symptoms of anxiety actually overlap with symptoms of heart disease and stroke. So if you're unsure whether or not what you're experiencing is anxiety, please always check with a medical professional. Some common symptoms of anxiety include feeling restless, agitated, or overexcited, trouble concentrating, muscle tension, sleep challenges, feelings of panic or panic attack, feeling as though your thoughts might be spiraling, or worries or fears that are out of context for your situation. If any of this sounds familiar, you may be asking what you can do. The good news is there are simple and effective ways to manage anxiety and frustration. The strategies I'll talk about are useful for anyone experiencing these feelings and may be particularly helpful after a stroke. The first step is always to talk about it, to name and identify what you're feeling. If you have trouble with words, speech, or knowing what you feel, using a feelings chart like the one on the side of this slide can help. The most important part is that you feel safe with who you're speaking. Another step that everyone can take is ensuring that your basic needs are met through self-care. So self-care includes eating a healthy and balanced diet, getting adequate sleep and physical exercise, and maintaining social connections. It's also very important to learn to identify and reduce warning signs of stress. If you want more information on this topic, a helpful guide is listed in another one of these video series. The steps on this slide are really important preventative strategies to help with frustration and anxiety before they arise. So how do we manage feelings of frustration and anxiety in the moment when they do occur? We do this by using body exercises that counteract these feelings by relaxing the mind and body to feel more peaceful, safe, and calm. When we act purposefully to calm the body's physiological response, the brain reacts by calming as well. In the next slides, I'll show 3 exercises to help lower emotions and bring our awareness and focus to the present moment. Deep breathing is one of the key ways to relax the mind and body. This is because when we take the time to breathe deeply and intentionally, it sends a message to our brain to relax. Slowing down our breath helps to counteract the body's stress response in turn slowing our heart rate, slowing our breath rate, and by lowering blood pressure. To do this, first sit or lie down in a comfortable position. You can close your eyes or focus on something in front of you. If you like, place one hand on your chest and the other on your belly below your ribs. Take a deep breath in through your nose, inhaling for 3 to 5 seconds. And try and notice your belly rise as the air goes in. Next, exhale or breathe out through your mouth. This should feel like you're blowing gently over a hot cup of tea. Repeat this breathing sequence 4 to 5 times and take your time with each breath. Notice how you feel at the end of the exercise. Another strategy is sensory grounding. Research on mindfulness and meditation tells us that focusing on what we sense in the immediate environment can reduce the mind from wandering too far into the past or too far into the future, and this can relax the body response. So to do this, sit comfortably and take several deep breaths. When you're feeling relaxed, start by naming 5 things you can see in the room around you. If you have trouble with speech or finding the right words, simply modify the exercise by visualizing the item in your mind or intentionally noticing it in the room. Repeat with 4 things you hear, 3 things you can touch or feel, 2 things you smell, and 1 thing you can taste. If your stroke has affected your sensory abilities and any of these steps cause pain, discomfort, or frustration, simply modify the exercise by skipping that step. The third strategy is muscle relaxation. So it's really common to go about our days carrying lots of tension in our muscles when feeling frustrated or stressed. This quick exercise teaches what relaxation feels like and how to quickly recognize when you're feeling tense during the day. To do this exercise, sit comfortably and take several deep breaths. I've listed 4 muscle groups and how to tense them on this slide. Beginning with the face, start by tensing or squeezing the muscles as you inhale and count to 5. Release or let go of the muscles as you exhale slowly. Focus on noticing the difference between a tense muscle and a relaxed muscle. As you relax, you can say or think, relax, calm, or safe, and imagine the tension leaving your body. Repeat with each muscle group, pausing for at least 10 seconds between each step. If your stroke has caused any difficulty or pain on one of your limbs, shoulder, or face, simply modify the exercise by skipping that step or doing the tension release only on the opposite non-affected side of your body. Don't push yourself to do anything that causes pain or discomfort. In the final minute of this video, I'll talk about communication, boundaries, and dealing with tension. It can be hard to recognize our own feelings and needs, and even harder for those around us. Managing frustration and anxiety involves having a plan for how you will communicate when emotions are high or when faced with fatigue or cognitive problems. When possible, use clear, specific language to express your needs. Think about, who will you tell? What words or tools can you use? Where will you go to take a break, and what will you do? Good communication also involves setting boundaries. Identify your needs for social or family interaction, breaks, and alone time, and share these with others supporting you. The more clearly you can define your boundaries, the easier it is to talk about them and to refer back to them. It is always okay to ask for what you need.
As we wrap up this talk, I'd like to leave you with 3 key takeaway messages. First, remember that mood changes are common after stroke. This means that it is important to know the signs of anxiety and frustration and talk about how you're feeling with those who you feel safe and supported by. We also know that practical strategies can help reduce anxiety and frustration. Try using the strategies covered in this talk, including deep breathing, sensory grounding, and muscle relaxation. You can find handouts containing instructions and pictures used in this talk on the resource page. Finally, if you're concerned about mood changes or have trouble using any of these strategies, please reach out to a medical professional.
This concludes the talk on practical strategies for managing anxiety and frustration. I hope you found this information helpful in learning about this topic and ways you can manage emotions. If you have any questions or concerns or are struggling with mood changes, please reach out to your physician or another professional on your healthcare team. Further information, including links to the Canadian Stroke Best Practice Recommendations, are listed on the resources page.